أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي ربي زدني علما وألحقني بالصالحين السلام عليكم ورحمة الله وبركاته. So, dear guys, today inshallah, just a minute. Today inshallah we will have to learn that what a conversation or dialogue is, okay, and how to write a dialogue, and after that we will go towards what, towards writing the dialogue that is over there in the scheme. So my dear students, to write a dialogue, that is a very simple and easy thing. As we two people talk on anything, any topic, or whatsoever the issue is, but whenever two persons talk about anything, any problem, any issue, that is a dialogue. The way they meet each other, the way they greet each other, the way they start the discussion, the way they argue each other, the way they discuss the matter, the way they tell the qualities, okay, the uses, the misuses, the benefits, the way they do what? They draw the sketch that what the thing is. Maybe we see that in our homes, our parents, in our uncles, and so many other people, they discuss politics, okay, and all these things. So whenever two persons are talking, discussing, or arguing with each other, or on any issue, any topic, that is called conversation. The word dialogue means, the word die means two. The word die means two, and log mean debate. So debate of two persons, discussion of two people, conversation of two persons. Okay, that is called dialogue. That is called what? Dialogue. So our today's job is to write a conversation or a dialogue between doctor and patient. So you will have to open your notebooks because we need to write it. So my dear students, you will have to start, and we will start like two Muslims. Whenever two Muslims meet, what they first of all do, they greet each other with assalamu alaikum wa rahmatullahi wa barakatuh, like this, okay? And the opposite person, he will say wa alaikum assalam wa rahmatullahi wa barakatuh, as you see. And after this, they will come to what? To ask about each other's goodness, okay, and in okay, in well wishers, and sorry, and wishes, and so many other things, that what, how about your health and all these things, okay? So they will what? First of all, they will inquire about each other's health, okay, situation and life and all these things, and then they will start the discussion. So similarly over here we have started, okay, we have done it. As the patient is saying, okay, the doctor, maybe he is in a hospital, okay, or in his clinic, but the patient goes over there and the patient says assalamu alaikum wa rahmatullahi wa barakatuh, okay, or now the doctor says wa alaikum assalam wa rahmatullahi wa barakatuh, how are you? Patient, I'm not feeling well, sir, I have headache. I have what? I have headache. Headache mean pain in head, okay. And I have headache since when? Okay, I have headache since yesterday evening. Since yesterday evening, I'm not feeling well, sir. Okay, I have just regularly and continuously having this pain in my head, that my headaches. And then, doctor, have you taken any medicine so far? The first question the doctor will ask, that how are you? What is the issue with you? Have you any what impairment or any issue or any difficulty, then the patient will narrate his story, okay, or his situation, that what I feel and what is the problem with me. And then after that, the doctor will ask that, have you eaten something for it? Have you taken some pills, okay, or some medicines, anything like that, tablets? Have you taken any medicine so far? The patient, yes, sir, but the headache hasn't disappeared. Yes, sir, I had taken, okay, maybe Panadols or Disprin or something like that, okay, the painkillers, but they what? They did not work. They did not work. Similarly, and same what? The pain is same, the headache is same. It is not going to disappear. It is not going to disappear. Doctor, do you have a running nose? Yeah, you have a running nose. Look like your headache is a result of flu. So when the doctor observes, examines the patient, he sees that his nose is running. Okay, so he came to the conclusion. The doctor came to the conclusion that your headache is just because of your flu. Your headache is just because of your flu. That is not a regular okay disease. Uh, so that is not nothing from anxiety or fatigue. That is just a common thing. It comes with flu. Okay, and let me check, and then the patient is examined thoroughly. The patient is checked thoroughly. You have a running nose. Okay, looks like your headache is a result of flu and not the regular one that results from anxiety. Sorry, the E is missing over here. So this is not the thing, okay, that maybe you have some other ailments or issues, okay, or problems, but this is maybe the result of flu and not the regular one that results from anxiety. Let me check. The doctor checks the patient or examines the patient thoroughly. Doctor, it's quite clear that the flu is the reason for your headache. The doctor tells him after the examination, Abdullah, what is it? If you are not interested in the class, you can leave. We are not forcing anyone. You will not come to the class, you will be fine. But if you are just disturbing us, I think once again that will be a source of fines and so many other punishments. So the doctor, after the thorough examination, okay, of the patient, the doctor is going to tell him the conclusion. It's quite clear that the flu is the reason for your headache. There is no other reason. There is nothing else. Okay, there is no sinus or there is no other issue. I will prescribe an antibiotic to clear the infection, okay, and a pain reliever or pain killer to relieve the pain. To relieve the pain. The patient says, thank you so much, doctor. Allah Hafiz. Assalamu alaikum. And then the doctor says, okay, welcome. In Allah Hafiz. Wa alaikum assalam. That was the conversation. That was the dialogue. So as I had told you, that dialogue mean when two people or two persons, they are discussing any issue, they are just discussing any problem, any matter with each other. And how will they start? How two Muslims when they
Sir,
meet, conversation? Yes.
sir, we should write on notebook.
If you can write from yourself, that will be better, but you better note it also because you will need it.
Okay, sir.
Okay, so you will
Okay.
have to write it.
Okay, sir.
So conversation or dialogue, as I had earlier told you, that it is a discussion between two persons. When two persons are discussing any issue, any matter, any problem, anything. So the way they meet each other, the way they greet each other, the way they ask about each other's health, okay, and situations, in the way they start the matter, the way they resolve the matter, the way they depart. All these things will be included while writing it. What? While writing the conversation or the dialogue. So we are Muslims. We will have to follow that code of conduct. That code of conduct. Okay, that how a Muslim or how Muslims meet each other, and then how they live and how they talk and how they discuss. So that is the thing. Once again, I'm reading it, and then one or two boys will read, and then you will write it. Passion. Assalamu alaikum wa rahmatullahi wa barakatuh, doctor. Doctor, wa alaikum assalam. How are you? Patient, I'm not feeling well, sir. I have a headache. Okay, I have headache since yesterday evening. Doctor, have you taken any medicine so far? Patient, yes, sir, but the headache hasn't disappeared. Doctor, you have a running nose. Looks like your headache is a result of flu, and not the regular one of that from anxiety or fatigue. Let me check. The doctor checks the patient, examines the patient thoroughly, and the doctor says, what? It's quite clear that the flu is the reason for your headache. I will prescribe an antibiotic to clear the infection and a pain reliever to relieve the pain. Patient, thank you so much, sir, doctor. Allah Hafiz, Assalamu alaikum. And then the doctor would say, what? Alaikum assalam wa rahmatullahi wa barakatuhu, and welcome. That was the dialogue. If anyone want to read it, you can read it. Okay.
Sir, I want to read it.
Yes, you can.
Okay, sir. Patient. Assalamu alaikum, doctor. Doctor. Walaikum assalam. How are you? Patient. I'm not feeling well, sir. I have headache since yesterday evening. Doctor. Have you taken any medicine so far? Patient. Yes, sir, but the headache hasn't disappeared. Doctor. You have a running nose. Looks like your headache is a result of flu and not the regular one that results from anxiety and fatigue. Let me check. The doctor checks the patient thoroughly.
Thoroughly,
Doctor.
that is not okay. Thoroughly, thorough mean a thing that you do with full concentration. Okay, or a thing that is deep.
Okay, sir. The doctor checks the patient thoroughly. Doctor, it's quite clear that the flu is the reason for your headache. I'll prescribe an antibiotic to clear the infection and a pain reliever to relieve the pain. Patient, thank you, doctor. Allah Hafiz. Assalamu alaikum.
Okay, so anyone else who want to read?
Sir, I want to read.
Yes, okay, Fiza, start.
Patient. Assalamu alaikum, doctor. Doctor. Walaikum assalam. How are you? Patient. I am not feeling well. Sir, I have headache since yesterday evening. Doctor. Have you taken any medicine so far? Uh, Patient. Yes, sir. But the headache has not disappeared. Doctor. You have a running nose. Looks like your headache is a result of flu and not the regular one that results from anxiety or fatigue. Let me check.
Fatigue, that is fatigue, you know. Fatigue mean when somebody is tired or feeling somehow unrest, not feeling well, feeling bored. And anxiety means tension and depression. Okay, tension and
Okay,
depression. Got it?
okay, fatigue. Let me check. The doctor checked
Fatigue.
the patient uh,
Thoroughly.
fatigue.
Okay.
That let me check. The doctor the doctor checks the patient thoroughly.
Yes.
Doctor, it's quite clear that the flu is the reason of for your headache. I will prescribe
I will
an
prescribe an
antibiotic
antibiotic to clear the infection in a pain
infection.
reliever to relieve the pain.
I will prescribe an antibiotic to clear the infection and the pain reliever to relieve the
Reliever.
pain.
Yes.
Patient. Thank you, doctor. Allah Hafiz. Assalamu alaikum wa rahmatullah.
Okay.
I
Yes.
can read.
I want to read.
Who
Sir,
wants
I
to?
want to read.
I want to read.
Okay, okay. You will have to start writing also. Okay, read and write both. Okay, who want to read?
Hassan Liaquat Ali.
Sir,
Okay,
Mohammed Hamza.
Hassan
okay. You
Liaquat
will
Ali.
you will have your turn. So please, one by one, you all can read. Start reading.
Sir, Mohammed Hamza.
Okay, start. Where are you, Mr. Hamza?
Sir, I can read.
Yes, Abdullah. Start reading.
Hassan Liaquat Ali.
When will you start?
Yes. Patient, Assalamu alaikum, doctor. Doctor, wa alaikum assalam. How are you? Patient, I am not feeling well, sir. I had since yesterday evening.
I have headache. You know this is the short form. Full
Yes,
form is I and have. Okay,
yes,
and this is pronounced as I have. This is
yes,
contraction. I apostrophe ve have. Got it?
yes, yes. I have had since yesterday evening. Doctor, have you taken any medicine so far? Patient, yes, sir, but the head has not disappeared. Doctor, uh, you wear a running nose. Look, your head is a result of flu, and
Your
not the
headache,
regular one that results from an
anxiety, and fatigue.
anxiety and fatigue. Let me check. The doctor checked the patient thoroughly.
Thoroughly.
Yes. Doctor, it's quite clear that the flu is the reason for you had I'll prescribe an antibiotic to clear the infection and a pain reliever to relieve the pain. Patient, thank you, doctor. Allah Hafiz. Assalamu alaikum wa rahmatullahi wa barakatuh.
Sir, I want to read.
You want to read? Okay, you can read.
Patient. Assalamu alaikum, doctor. Doctor, wa alaikum assalam. How are you? Patient. I am not feeling well. Sir, I have headache since yesterday evening. Doctor, have you taken any medicine so far? Patient. Yes, sir, but the headache has not disappeared. Doctor, you have a running nose. Look like your headache is a result of flu and not the regular on that results from anxiety and
Anxiety and fatigue.
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 Let me check. The doctor
Fatigue.
checked.
Fatigue means pain in body. Okay, when someone is feeling tired. Okay, our
The
muscle.
doctor
Yes,
the doctor checked the patient thoroughly.
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 Yes.
Doctor, it's quite clear that the flu is the reason for your headache. I will prescribe an
Okay. Yes.
antibiotic
Okay.
antibiotic to clear the infection and a pain reliever to relieve the pain. Patient. Thank you, doctor. Allah Hafiz. Assalamu alaikum.
Sir, I can read.
Yes, you can
Sir,
read.
I have read.
Rayan and Jum.
Sir, Muhammad
Okay.
Hamza.
Okay, Muhammad Hamza, I gave you the turn, but you missed it.
Okay, sir.
Okay, just anyone who want to start reading. And
Okay,
if
sir.
there is any word difficult, anything you don't understand, I'm over here. And are you all writing?
Yes, sir, I did.
Okay, hurry up.
I write completed.
Okay, start reading.
Okay, sir. Patient, Assalamu alaikum, doctor. Doctor, walaikum assalam. How are you? Patient, I am not feeling well, sir. I have had headache since yesterday evening. Doctor, have you taken any medicine so far? Patient, yes, sir, but the headache has not disappeared, doctor. You have a running nose. Look like your headache is a result of flu and not the regular one that result from a- anxiety
Anxiety.
and anxiety and fatigue. Let me check. The doctor checked the patient thoroughly. Thoroughly, please.
Thoroughly. Thoroughly.
Thoroughly. Thoroughly. Doctor, it's quite clear that the flu is the reason for your headache. I will prescribe an antibiotic to clear the infection and a pain reliever to relieve the pain. Patient, thank you, doctor. Allah Hafiz. Assalamu alaikum.
Okay, so guys, if you still feel anything difficult, you can ask me. Is there anything difficult?
No, sir.
Really?
Yes, really.
Clear?
Always clear. Clear.
Okay, so please write it.
Okay.
Okay, thank you.